I hosted or sponsored a very similar event a few years back that Hope for ME also organised, and I have to say it's absolutely inconceivable that despite the buzz, despite the real positivity in the room and the very, very strong message sent from the ME community, that all these years later we still do not have an ME clinical lead. So we've just come through our last mandate as an assembly, and we've had a year of a political impasse. But the issue of ME was raised many times by myself and by other health spokespersons. And again, it's unbelievable that despite all the talk and the reviews and the working groups and the potential commissioning, that we are no further forward. So it's a beautiful evening. Ordinarily, I would be out campaigning, knocking the doors, trying to get votes for the council election next week. And I have to say, without fear of contradiction, that health is by far the most important, most pressing issue that people are raising with me. To say that they're raising it is an understatement. They're spitting feathers at the state of it right now. And if I'm hearing that, I am sure every other political party and representative is hearing it too. So let's hope next week, after the council elections, we get a bit of political movement here, because the glacial space at the minute is dire, as is the financial situation of the Department of Health. So on that very dreary note, I'm going to congratulate Hope for ME and all the campaigners for pulling this event together this evening. I wish you all well, and I hope you enjoy everything you have to hear. Thank you.
Firstly, I'd like to offer sincere thanks to every healthcare provider for attending and giving us a full house tonight, especially during such difficult times for NHS staff. I wasn't going to speak tonight, as my experience is told well in Discover ME, but I have been inspired to say something through two breakthroughs this week, one in the Southern Trust and another one being presented by our final speakers from the universities tonight. And thank you too to every single volunteer and members who support the charity. Hope simply wouldn't exist without you. And to our families, without whom none of what we do would be possible. So please bear with me for 4 minutes to help understand our difficult journey, to overcome the stigma, the disbelief and the lack of specialist services in Northern Ireland we have endured for decades. But things are finally changing, and forever the optimist. Slide 2, please, David. The World ME Alliance theme this year is post-exertional malaise, or PEM, the defining feature of ME. And our Discover ME film made 3 years ago is about PEM. So couldn't be any more appropriate for this World ME Day, and it wasn't planned like that. So PEM is only invisible when ME allows us to give these award-winning performances of acting wellness. But PEM will certainly be visible to our families over the next days, weeks or months. Slide 3, please, David. There are odd occasions when symptoms are tolerable enough to leave the house, and we often hear, but you don't look sick. Really, we should reply, well, you don't look like a VO2 max rig. But we don't. Please visit our Workwell information stand and feel free to take, it's on the left down there I think, feel free to take any literature to share with colleagues. So as Linda will explain more, the charity has worked very hard since the first meeting with the lead commissioner for ME in 2011. And after 7 years of gruelling meetings, our efforts appeared to pay off when Sir Michael McBride performed the opening address at our First Do No Harm annual conference, when he said, no patient should have to fight for recognition of their condition. That many of you have had to do so is a matter of great regret to me. So that meant an awful lot of to us to have acknowledgement like that for all the years of neglect and suffering that we've had to endure. Slide 5, please, David. A few months later, we received written confirmation from the Department of Health that recruitment for a new ME lead had been successful. And the Patient Client Council website also announced a new ME clinic was established. None of which would have happened without the support and years of hard work by Dr. Pamela Bell, who's here tonight, Dr. Christine McMaster and Louise Skelly of the Patient Client Council then. But a year later, we were informed everything had fallen apart due to internal issues within the Belfast Trust. We were, and still are, shocked and devastated, as 7 years of work had been lost. And for an ME patient, I don't know, we just don't have the words to explain that. Slide 6, please, David. Then COVID also happened, and the Health and Social Care Board was disbanded along the way. And we knew from experience that every virus has the potential to cause strikingly similar symptoms to ME, and even published this article in 2020, it's now 23 and we're still doing this, on the European Connected Healthcare Alliance website to warn about PEM. So unfortunately, the inevitable has happened in one of the 4 distinct groups of long COVID, as scientists call COVID-induced ME. And this one group is presenting with PEM. This is not the same as saying all long COVID is ME, because it's not. Slide 7, David, please. So, the Southern Trust breakthrough. In 2014, we brought neuroscientist Professor Mark Van Ness to Stormont from the Workwell Foundation, who specialise in sports medicine, and an ME petition with thousands of signatures demanding specialist services for the 7,500 patients we represent in Northern Ireland was handed into the Assembly. In 2023, just last week, the Southern Trust produced a long COVID Tiger page. That's an online help for patients. And lo and behold, it includes the Workwell ME fact sheet on ME and on PEM. This ME info may have come through the back door of long COVID, but we are still incredibly grateful to see ME and PEM info circulating within the Southern Trust, and we hope that other trusts will soon follow suit. So our ME consultant-led clinic is needed more than ever, as numbers of this one group of long COVID with PEM rise. And as you will learn this evening, how ME education to offer early diagnosis and early intervention would help avoid the same mistakes and the same suffering of the past, when we were told to exercise and push through symptoms for a disease where pushing harder makes you sicker. And as Dr. McBride has stated, no patient should have to fight this hard. So this evening is dedicated to the memory of Northern Ireland-born Dr. Jonathan Kerr, educated in Queen's University, Belfast, who recently passed away, a dear, dear friend, colleague, and a giant in the world of ME research. So that's it. I will now hand you over to our eminent experts, and I haven't a clue who's on next, to whom we are sincerely grateful for providing this unique opportunity to discover ME and to discover PEM. So thank you for listening. Thank you.